Okay. Welcome, everyone. It's June 8th, 2021, and this is a meeting of the Board of Health for the town of Northborough. We're going to start with some housekeeping. First, we'll hear from Kristen Black with regards to the orders from Governor Baker.
Okay, thank you, Mr. Chair. I'm going to now read our remote meeting script. Good evening, my name is Kristen Black. I'm the Town of Northborough Health Agent. This open meeting of the Board of Health is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, the Town of Northborough has been advised and directed by the Commonwealth to suspend public gatherings, and as such, the Governor order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. All members of the Board of Health are allowed and encouraged to participate remotely. The order allows the Board of Health to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream of this meeting may do so by going to the Northborough Remote Meetings on the YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless participation is required by law. This meeting will not feature public comment, but I feel like I need to amend that statement because we do have the webinar feature today. As noted in the agenda, there is a webinar feature and there will be a time for public comment. We'll cover on 61 Maynard Plan Review, and that will be handled by raising your hand using the webinar feature. And again, each vote taken by the board will be conducted by a roll call vote. So Mr. Chair, would you like to do a roll call for attendance? Thank you.
Yes, I would. Thank you, Ms. Black. Let's see, we call the roll call for attendance this evening. When I say your name, please just say present. Yeah, my name's Glenn French. I'm the chair of the Board of Health. We have Dilip Jain.
Present.
Swati Sane.
Present.
And Teresa Capobianco.
Present.
Okay, all members accounted for. We will proceed with the meeting. Call to order. It's about 6:07. And so we need okay, 6:07, we're on the board. We will proceed with approval of the May 11th, 2021 meeting minutes. And I assume everyone's had an opportunity to review them. And I would, any questions or concern from the board?
No.
Nope.
Teresa, no.
No.
Dilip,
No.
No.
Swati,
No.
no. Everyone's good?
Yep.
Okay, in that case, I move that we approve the meeting minutes from May 11th as recorded. I would entertain someone to second that.
It's
Seconded. All those in favor?
aye.
Aye. Aye.
Very good. Okay, item number 2 on the meeting agenda is the COVID-19 update. For that update, we will turn to our very own Kristen Black.
Thank you, Mr. Chair. So numbers are looking very good in Northborough. Obviously, we're seeing all numbers across the state are declining, percent positivity, et cetera. We are no longer doing the weekly update graphic on the Town of Northborough's pages, but many of you are all familiar where you can find the state case counts by municipality if you're interested in that information. We're continuing to run our vaccination clinics at the Doubletree site. That is going to wrap up with the last clinic date on June 22nd. So we have both some Moderna second dose clinics, Pfizer second dose clinics, and we also do have J&J available. Those are handled, the J&J we are accepting as walk-ins. All of our clinic dates are posted on the town's website. If you go to the COVID-19 banner, there's a page on the left called the Metro West Westboro Regional Vaccination Site. So those dates are there. And there'll be another notice going out hopefully this week through the schools, encouraging individuals to register. I'm going to try to share some of our town data. I don't have a big pretty presentation for all of you today, but I at least can walk you through. This is a table that just shows these 7 towns listed here are all part of our regional association. So the data was as of June 1st. So Northborough, just sort of going along, for our town, again, I think we're up there on top 5 in the state for communities over 10,000. We have an 84% vaccination rate overall. If we go into our next category, our 12 to 15-year-olds, we're at about 64% as of last week's report. I'm competitive. I'm a little disappointed. We're not keeping up with Southborough and Westborough. They're nearly 80% or just over. So we're doing a bit better, but we're nearly there. As you move along in our column here with the fully vaccinated, with the 16 to 19-year-olds with 1 dose, we have over 95%. That metric's been there for the last 2-3 weeks. So the 16 to 19-year-olds, over 95% are fully vaccinated. Have 1 dose. 83% are fully vaccinated. Our 20 to 29-year-olds, 92% have had that first dose. And then you move through the 30 and over 95% have received that first dose. And if you're 50 and over, for our residents, over 95. I'm looking at this, the 65 and over all have 95% or greater fully vaccinated. So again, we have some of the best vaccination numbers in the state. And we have lots of options for residents at local pharmacies. We aren't quite seeing the COVID vaccine in pediatric offices unless Dr. Sane knows more. But again, what we're encouraging people will still take walk-ins for first doses at our regional site. And you could get your second dose at a pharmacy or maybe a pediatric office. But for the residents who have been waiting because they wanted to get it at their doctor's office, just realize not many doctor's offices are offering it. And so we might be a good place for your first shot and then you could maybe return to your doctor's office for your second or to a local pharmacy. So we'll stop the share. So I don't know if you have any other questions. It was a busy week of a lot of things. One thing we're really struggling with is vaccine ordering and really trying to perfectly time the demands, the appointments, projected no-show rates, so we don't have any vaccine wastage. We did have a power outage at the DoubleTree I wanted to make you aware of on Saturday. Brian Roberts, our site coordinator, was there within an hour and a half of that power outage. We reported to the vaccine unit and contacted all 3 manufacturers, and there's no need to the vaccine is still approved for use, and we ran it by the sites. Dr. Ulrich from Westborough's Board of Health is listed as the ordering provider. So that worked itself up the chain. We didn't lose any vaccine, but we are looking, we anticipate we're gonna have approximately 300 extra Moderna doses, just the way it worked out. We took some from the city of Worcester who had expiring doses. So it's a lot of shuffling of vaccine across the state, making sure things don't expire. And we're finding homes for those extra 300 Moderna shots. And then on Pfizer, I think we're going to be spot on. We have enough vaccine to get through next week. And then what we'll do is we'll go pick up a transfer from another clinic so we don't have to take a full tray of Pfizer and end up with wasting any vaccine. So yeah, we're in great shape.
Great.
The volunteers for the MRC and CERT have really come through huge this week. One of our clinics, I want to say we have over 9 volunteer vaccinators for a single shift. So our clinic, which originally started off with all paramedics, the firefighters, we're serving those roles. We've really transitioned into a, 50-50, or even certain clinics are even more leaning towards a fully volunteer MRC base. So we've had volunteers from all over, coming from Boston, and pharmacists and doctors and paramedics from other departments. Obviously, all the vaccinators are meeting the state's requirements, but just amazing outpouring of support to run these clinics. So we are working on a small token of, to express gratitude for individuals, something to present to them to commemorate their involvement in the clinics. But we're in good shape, and I'm looking forward to the other side. We're starting to work on other things in the office, and but the clinics and the town seems to be in pretty good shape there.
Well, it's amazing. These vaccination programs are really, it's nothing short of a little miracle. How suddenly it's, this terrible disease has just been beaten down. And, this is to the doctors of the group. Is the vaccine what's caused this just dramatic decrease in COVID cases? Is it the vaccine that's just done it, or is there some other factor going on here that's just, attributable to the decrease? Dr. Jane, Dr. Sana.
No,
So-
let the lip talk.
So, I mean, I think it's a combination of factors, Glenn. I think
Yeah.
it's one, the prolonged mask wearing, social distancing did help with some of that, but I don't think you saw the rapid decrease that we have seen until the vaccination process started to begin with. I don't know if the weather warming up has had any effect on some of that too, because if we think about, warmer weathers, that viruses tend not to survive in that, but that wouldn't explain what happened in India with their second surge, because they're in their peak warm months. So I'm not sure how to explain that. But yes, I think the rapid decline is probably directly attributable to the COVID vaccine, the way it's been rolled out. And yes, while our state had little trouble with the actual rolling out and the registration website and all that stuff, but of course now, things are really good with walk-ins available anytime you want to the point that now they're going to start shutting down the state sites, in a staggered fashion, starting next week, I believe, with Gillette being the first one to get closed down. So, I would say that that's probably the biggest factor, because people are going out now. The next question should be is, what's going to happen? Are we going to see any? Well, I guess in 2 months we'll see.
Right.
If we start to see a surge because people are now doing what they have not been able to do for a year and a half or so, then we may have to rethink that whole process. But that's my thing. I don't know if Swati has anything addition or
No,
something
I
different.
totally agree. Various factors, but the vaccine has definitely helped. And I think studies have also shown that if you're vaccinated, you're less likely to transmit COVID too, if you contract it yourself. So,
Yep.
And I think the people who are vaccinated are also better about masking still.
Yeah.
I see like a direct correlation. I think the masking still it is definitely needed, especially in our medical facilities. I'm glad we are still doing it.
Yeah. And the other thing I think that I've seen or have read about is that, while Moderna and Pfizer had 94, 95% efficacy, now that they're seeing that in vaccinated individuals, it's close to 100% efficacy. So that's, and again, you can't determine that through trials and phase 1, phase 2, phase 3 trials, but in the real world, when you're seeing what's happened, they're saying it's approaching almost 100% that Moderna is going now after 2-year-olds and above, and hoping to get approval from that, So that'll be a huge impact if they can get that done.
Yeah, hopefully by September. So once school, daycares, everything.
Yep.
Yeah.
Full-fledged, yeah.
Well, great.
Thanks, Katie,
Just
for
great.
good work.
Yes.
Katie
Fantastic.
and
Shots in
everyone.
the arms.
Yeah, Kristen, they're doing a wonderful job.
I just
Mr.
there's
Emily?
one other update from the state I wanted to make you aware of. A lot of people didn't realize the state changed their definition of a close contact now to exclude any exposures outside. So I think it's going to help make a lot of families a little more comfortable for enrolling their kids in outdoor camps and those sort of things. So what that means is that if, let's say, your child were to be in a camp and they're running around on a soccer field for 4 hours, if another child, became positive, we are not determining anybody in an outdoor setting to be a close contact and requiring quarantine. So quarantine and isolation, it's still there. I think a lot of people think we don't do that anymore. No, we're still doing that. It's still a role of local boards of health, and it's still a requirement. But the change in that definition, you know, if people were to have an outdoor party and find out that we had a backyard barbecue and somebody was sick, and does everybody need to stay home for 10 days? If the exposure was all outside under the DPH's new definition of close contact, they wouldn't be required to quarantine. Not that we wouldn't advise people with or without, you know, vaccination to continue to monitor for symptoms and get tested, but it's not a required close contact. So that might change, you know, things for some families this summer. And so more reason to, you know, have that play date outside and, you know, and then continue, especially with children and unvaccinated, to encourage outdoor settings. I mean, we are seeing breakthrough cases where vaccinated, fully vaccinated people are getting, you know, COVID, although it's often milder. It doesn't, you know, it hasn't all ended. So outdoor is still a great way, especially in these warm summer months.
Oh, very good. Does anyone have any comments or concerns on that?
No.
Very good. Should we go on with the 61 Maynard Street? I think we should. Okay. This is a request for a local upgrade approval for 61 Maynard Street for reduction in minimum setback to well and reduction in minimum setback to building foundation. My understanding is Brian Sullivan has the engineering on this. And we're looking at a picture of it now. Okay, so maybe Kristen, if you could just give us a little background as to what we're looking at and what they're seeking.
Sure. So sorry, I'm just struggling to zoom and move a couple things around in my screen. So I want to try to zoom in. So again, the stress is this is a existing house. So existing well, so none of this is new. They're not upgrading or increasing the size of the property. So we're maintaining the same number of bedrooms, the same capacity. It is a needed repair. You know, they have I believe a Title V failure. I can't remember if they were selling the property or not, but I hope all of you, if I've zoomed in enough, I know it's so hard. I hope nobody's on their phone today. So, oh wait, we have Dr. Sani's on phone. All right, I'm gonna try to
I'm
zoom
on my
in.
phone.
Okay, all right. So I'll try to point with my cursor if you guys can see this. So here is our existing property. This is the house. The road is sort of out here at the front of the property. And so there's a driveway right here. This box here says relocate driveway. So again, the dark writing, the darker is the proposed. It's a little tough to see the lighter, but the well is at the back corner of the property. So here is our dwelling. The well, it's an existing well. These are smaller homes. I want to guess it was a 3-bedroom. I got to scan over to that. This well, you can see there's a note I had the engineer add. They share the well with the abutter, who is located, you know, next door. So it's been a shared well system forever. And so if it wasn't a shared well, we wouldn't require a butter notification or anything like that, because you can have a setback from your own well, you know, a deviation below the 100 feet. But if it affects somebody else's well, given this is shared, we do require under Title V that abutters are notified. The important thing to note here is it's really the same locations for everything. When I see a well really close to a septic system, existing or current, I require a recent water quality test to make sure that we don't have E. coli or any like bacteria or anything like that. That would be a concern that you would typically see leaching from a septic system and impacting the well. They did come back and with the water analysis, and that passed. So there are no issues identified with the existing well. And so I want to just circle this bubble thing, which sort of looks like a cloud here. This is the existing system. So they're actually moving the system a little bit farther away from the well. They're not getting closer to the well, but the site's really difficult. It's a narrow lot. We hit a bunch of ledge. So, you know, when we did the deep holes, we thought, okay, let's put it closer to the road. That gives us more distance to, you know, from the well, but there was ledge. There wasn't the 4 feet required of natural material that's needed to site a septic system. Yeah. So there really was no alternative on this site. You know, you could see that the engineers, Connor Stone's really good to work with. They did multiple deep holes and they just didn't have the right suitable soil. So this is really the only location. It is going to require an added expense for the applicant. They're going to actually have to relocate their driveway, right? Most times you just put the septic somewhere else. So I feel like they've done what they can. It's going to be a major upgrade. We're going, the requirements when they upgrade or repair or replace this system is that they'd have to go to the 2-compartment tank. It does require a pump chamber here, so it's not a gravity fed system. But I feel like it's designed well. It's probably going to be better than what's there now. And there's really no other suitable alternatives. And so I think Cornerstone did what they could with this design. But I just, want to point out it's a really tight lot. But as I mentioned to the chair before, the requirement, my understanding with these variances or these requests, it's called a local upgrade approval under Title V. So this request has nothing to do with the town of Northborough regulations on septic systems. This is just under the Title V of the state. So they do need a variance to be within that, within 20 feet of the foundation is one of the local upgrade approval or variances they're asking for, as well as not having the mandatory 100 feet from the well. They've always had 50 feet separation. The good news is the well test, the water test came back and that was okay. But again, given that there isn't a butter situation here, a shared well, I wanted to take it to the board and have that opportunity. I did send a quick email to Mike Sullivan to confirm the abutter was notified, and I had that return receipt or proof of mailing. I don't have that in hand unless Katie wants to jump in if you have any more information, Katie. But yeah, I'd leave it up
I
to
haven't seen anything either.
Okay, so I think whatever the board decides, I would make it contingent upon proof of notification of the abutter. If they don't have the proof prior to this meeting date, then I suggest that we may need to postpone this or to, reopen the hearing or a meeting for them to comment. What I hear from the engineer is that the abutter, the landowner lives out of town and there's currently renters living there.
How far away is it's supposed to be 100 feet from the well. How far away is it?
50. And that's sort of what it has always been with the existing system.
Right, it's in the same
location.
spot.
It might have actually been a little closer. It could have been 40. I'm not pulling out my ruler on this one.
Yeah.
It's probably a little, that's an approximate when you have the bubble cloud. That's about where that existing system is. But yeah, they're going for 50.
So nothing's really changed on this whole setup except for the regulation. Okay, and the second part of the setback from the foundation to the system is supposed to be 20 feet,
Mm-hmm.
and it's now what?
10.
Is there any sort of barrier proposed to go around the foundation? I know in the past we've had like some sort of plastic barrier to be applied around the foundation. Is that something possible?
I'm not familiar with that, just because it would be more digging to actually get to hopefully they get nowhere near the foundation and they choose an excavator that's going to do this work with care. Part of the setback from the foundation is just if you get too close, you could compromise the foundation as well. Whether they are, at 10 feet off and, which, would be allowed, I think, for a slab, but not a full foundation.
Is that the 10 feet, is that acceptable under Title V or no?
It falls under the local upgrade approval. So if, the Board of Health or its agent can allow for that.
Okay. Well, it seems they're between sort of a rock and a hard place. I have no further questions.
So Kristen, the well's in the same place.
Mhm.
The septic system is in the same place, correct? Essentially in the same place. So it's really not going to change the abutters system other than they need to be notified and we need to have documentation that they are being told that this is what it is, but it's really not going to change the physical dynamics of where things are right now. Correct? Okay.
Correct.
Yeah, if anything, it makes it better.
Right. They have a functioning septic system.
And also, I think the two compartment tank, you know what I mean? The
Yeah.
whole system is getting redone.
Yep.
It's not a piecemeal approach. They haven't cut any corners on this repair. That they're doing it to the greatest extent they can within the limitations of that lot.
And to second what Glenn was saying, I also remember a few of the previous septic repairs or redos about like a vapor barrier, for lack of a better term, like a plastic, barrier that they would put near the foundation, or at least at the edge of the septic system to prevent any potential. I do remember that in the past, but
Yeah.
maybe with these new systems, they don't have to do it. I don't know.
Yeah, we can
There's some-
inquire, for sure. Cornerstone's really good to work with, so I can research that a little more. I haven't seen too many of these so close to the house, so I'm happy to research that and recommend it if it's advisable. I don't
Okay.
see that being a large cost or addition, to the landowner to do anything like that.
Okay.
If they're already digging. I believe it was called a neoprene barrier.
Okay.
Glenn, I have a question if I may.
Ms.
Yeah.
Capabianco.
Thank you. Kristen, the plan as it shows up on my computer is still a little bit small, so I can't tell. To the northwest of the location where the system is going, is that another wellhead?
This right here, I don't know if you can see, so they are a full 100 feet from the other abutter.
They are, okay.
And then obviously you have the road, and then if you go to the back of the lot, it is what it is. There's, I'm not sure it's a subdivisions or lots out there. So they're meeting it to the other abutter,
Okay,
so there's no change there. And they did and that's why you're getting pinched into, I should have explained that. You're getting pinched in two directions. You have the well at the back, the well on the side with this abutter. So they did meet the full 100. So they didn't, all of a sudden impact that other abutter on that location.
okay. All right, is that a butter entitled to or required to have notice?
No.
Okay.
Because the variance wouldn't, or the local upgrade approval wouldn't impact them. So it would be any properties that would be impacted.
Okay, perfect. Thank you.
Sorry to interrupt. Sometimes I believe the screen share freezes. I don't think we've gotten the, when you zoomed in, I don't think we saw that. It still is the same, sometimes reloading it. Or if you share your entire screen as well. Oh yeah, that looks much better.
Oh, that's so
Oh,
much
yes.
Sorry, I was moving it all around for you.
better. Now I can see what's going on.
Okay, so this is the street here, Maynard,
Yep.
and this is the abutter. So you can see the full 100 feet from the well. So that's what was really
Okay.
pinching this location. That's why we didn't do any perks, over here, deep hole analysis out that way. So again, they're really staying the same on the well on the property. That's, again, that well is shared by the abutter to this location. It's not shown there, but it's noted with this arrow.
Right.
And so, yep.
Okay,
Thank
perfect.
you, Jim, for speaking up on that.
Okay.
So just, Mr. Chair, so I don't know if Glenn, you're muted. I don't know if we need a formal motion. The way we looked this up, right, Katie? The agent to the Board of Health can issue these local upgrade approvals on behalf of the Board of Health. And that's customarily what we do. If it's anything
Yeah.
tricky like that next one, or it's related to our local regulation, I would go to the board. So I don't think we need a formal motion. What I would propose, and I'm open to whatever you would like me to do, I will definitely research and possibly, require that neoprene barrier if it seems that's a best practice. And then I wouldn't look to approve this plan unless I have proof the abutter was notified, and that took place prior to this meeting. And if it didn't, and there's not evidence, I think I'd bring this up at the next meeting and postpone approving a plan on behalf of the Board of Health. Or if you prefer to vote and approve this on your own, however you would like to handle this.
The only thing I see is the two issues. One, notice. I'd feel more comfortable if we heard about the notice. So we can make it contingent upon, approval contingent upon proof of actual notice.
Mhm.
And then I would look into the poly. I thought I saw something, Kristen, on the first screen that we were looking at, to the left side of it, left side of the picture. If we can get over to the left, keep going left, like to the description almost. I thought I saw something that said poly barrier.
No, it's there. You're right, Glenn. I missed it. So there is a poly barrier. I don't know. I'm zoomed in.
Hey,
Let's see if you can see it. See, so you've taught me
Yep, it's
something.
right there.
It's poly barrier. I'm gonna keep zooming. It's right here, this dark line.
yep,
Mhm.
It's
That's
all
it.
around the corner. So anything within the, 20 feet looks to be
Yeah.
covered poly barrier. So it's
good.
there.
all right, so that's
Memory,
not,
Glenn.
no, it's good.
Okay.
Okay, anybody else? So we don't have to we don't need a motion on this. We can allow Kristen to go forward with it contingent upon the production of some sort of notice, proof of notice. Is that correct?
Yes.
Good. I have no problems with that. Does anyone else on the board?
If
No.
Glenn, just a question. If
Yeah.
the butter did not receive the notice, we're going to provide an opportunity to be heard again in the future, right?
Yes,
Okay,
it has to be.
yep, then I'm fine with that.
It is well. This is two people's wells.
Right, no, I understand.
Strange if they have a
Okay.
shared well, by the way.
There's a
How does
few,
that happen?
Well, and Jim, can you confirm that no one's here to comment? I noticed we have 3 attendees. 2 of those,
Yeah,
So we do have one hand
someone
up.
with a hand up, Robert McDonald. Could you allow
Correct.
them? If that's, Mr. Chair, if you're open to comments?
yes. Mr.
Absolutely.
McDonald.
So I will move them over to panelist for the time being so that if they can access their video as well if they would like, and then I'll move them over after. So I'm going to move them over now. All right, Robert, if you're with us, if you could just unmute, I believe we can hear you.
Okay,
Good.
And this is Caroline McDonald. I am his wife.
Okay. Welcome,
Will say
Caroline, Robert.
we have been in conversation with the abutter. I don't know if there has to be, I could definitely show you emails because they're located in, they live in North Carolina.
Okay.
They happen to be in Northborough at the moment, I believe. We have spoken about this. They're not unaware.
Okay.
And so was there something official that I was supposed to do about that?
No, Mrs. McDonald, I assume you're the owner of 61
I am.
Maynard Street?
yeah,
Okay. Okay. Well, no, as long as you can get in contact with the Board of Health, with the office, and, prove to them that
Well, would even,
notice was given, that'd be fine. You
Would-
just want to make sure there's no angry abutter who comes back from North Carolina,
I understand. that.
jumping up and down. That's all.
Else be proof? That's my question. Or was there some sort of formal thing that I was supposed to do?
I think they're supposed to be given notice by certified mail, return receipt requested, and
Okay.
then that card was supposed to be turned over to the Board of Health.
So typically that's not the landowner. So I talked directly to Mike Sullivan, the engineer, who had informed me he was taking care of that. So
Okay,
it's just a piece of paper that maybe came back to the office and they haven't forwarded it along. And
Very
if-
well.
I'm happy
Yeah.
to work if you have a relationship with the abutters and they want to, provide something in writing. I think we can
yeah, that'd be great.
work through that.
If there's something we can do to not wait another month, this has been a hardship. And
No,
we're very anxious to move forward.
So you wouldn't need to, if Mike Sullivan followed through on the request to notify the abutters, if he produces the documentation, I could approve this, this week. I just need the the evidence or the return receipt and certified number from Mike Sullivan. And he was informed of that several weeks ago.
Okay,
I will speak to him tomorrow then and try to confirm that that happened and.
Okay, and I sent him an email already as well requesting that, so he should be aware and he can contact me directly. So it's nothing on your part.
Well, even so, I mean, if the homeowner for the abutter is here in Northborough
Mhm.
at the moment, then I'm,
They
and
were,
they,
they were last week. I don't know whether they're
Oh.
still here. But I could find out.
all right, so it's just a matter of the homeowner, the abutter being notified, Mrs. McDonald,
Okay.
as you would want to be notified as well, you know?
They weren't trying to sneak this through.
No, of course not. Of course not. Yeah, Mr. Sullivan's very reputable. I'm sure he's taken care of.
Well, that's good.
The board will work with you, Mrs. McDonald, to get this thing done. We don't need to cause you any further hardship. We know it's a tough situation to begin with. Anything else from the McDonald's?
We're all set.
nope, I'm good.
Okay, very good. Thank you very much. Okay, so we're all clear on that? What's going on? Kristen,
Yes, I'll move.
board
forward.
members,
I could approve this week
Yes.
as soon as we get that notification.
Yes,
Yes.
Dr. Jane, Dr. Sane,
no questions,
Attorney
no problems.
Capabianco.
Yep.
All right.
awesome, thank you.
Good. All right, let's move on to, oh, the biggie. Vote to sign municipality statement of commitment for public health excellent grant program for shared services.
Mr. Chair, I'm gonna share. Can you all see this Word document?
Yes.
Yes,
Okay, I'm gonna
Yes.
try to zoom in a bit. So just as a reminder for the public, so the town of Northborough was awarded as the lead agency, the public health from the Mass Department of Public Health, a Public Health Excellence Grant Program for shared services in the amount of $300,000 per year over a 3-year term with prorated 2-month commitment for June and I guess May and June. So anyway, there's a lot of money coming to the town of Northborough. This is a shared services grant with total of 4 communities. So Northborough, Southborough, Westborough, and Boylston. And one of the state's requirements is that we all need to, they need to prove to the state we are in fact all equal and willing in this commitment to work together on shared services. So the state distributed this very simple form. It's due back to the state, as you can see noted here, on July 31st. So we would just fill in here, town of Northborough, it would be town of Northborough submitting it. And the towns need to attest that they are going to cooperate with the lead municipal agency to ensure compliance with the scope of services for the Public Health Excellence Grant Program for shared services. And also that you are going to check this box that you will use the funds provided under this program only to augment rather than replace current municipal funding for public health staff or services. So it's really important to note that the budget for the town's budget that was approved for the health department is not going to be reduced in any way. And actually, in fact, the Mass Department of Public Health requires that we can't reduce it. Obviously, grant funding is great, but it does go away at a certain period of time. This is a 3-year with a possible expansion to, I think, a total of 12 or 15 years. But that's all contingent upon state funding. So I think it's real important to note, that there's no changes to the budget. We are going to be adding 1.5 full-time equivalent nurses to our, new district of 4 towns. That's above and beyond what we have now, which is 0 nursing full-time equivalents. We do have a contract with Salmon VNA for $7,000 or $7,500 a year to provide some services. And it will also increase the hours for the food inspector and provide some software for both housing and food inspection, just as a summary. So It doesn't need to be a formal motion per se of the Board of Health, but it does require that the municipal chief executive or John Cordair and the Board of Health chair would sign and date this. Your fabulous chair wouldn't act without you knowing what was going on. So it's great to bring it to everyone's attention. And also know this isn't really the last time we'll be discussing this arrangement. We are also working on an intermunicipal agreement or an IMA that really outlines more of the legality of how it works with these shared inspectors and who's liable and who provides insurance and what do you do and who pays for what. All those details are in the IMA. This is a really just simple one-off form that we'd like to submit even this month. And then the IMA will also come back to you to review the IMA and to provide comments. We're working on a draft with a subgroup. So this is a formality of the grant. So.
Right.
Cool.
All right, well, so we've already discussed this wonderful grant. Should I stop by the office to sign it or should I, okay?
That'd be great.
All right, and it's available at the office, let's say tomorrow.
Yes.
And what time does the office open? 9 o'clock?
What's tomorrow? It's Wednesday, 8 a.m.
8 a.m., perfect. I'll be kicking around outside when you get there.
Okay. The doors are open. We're open to the public, so you can just march right in.
Okay, I don't have any comments or concerns about this. Dr. Jane, do you have any comments or concerns?
Do the other 3 towns have to sign on this thing?
Different forms, we all submit them independently, and then the
Okay.
state would just make sure each community that participates submitted a single form.
Oh, okay.
And this was again distributed in your packet. So if you're having trouble viewing it, it was also sent to you by Katie in
Right.
an email earlier.
Yes.
Dr. Sane, any comments or concerns?
No, this is, I think, a wonderful grant, a great opportunity for the towns.
Excellent. And Attorney Capabianco, any
No
comments or
concern.
concerns?
No, I think it's a great benefit for us.
Good.
Thank you.
All right. So I will see you tomorrow. And last item on the agenda before we get to general stuff would be the request for a local upgrade for approval of, request for a variance for 144 and 150 West Main Street. It's now past 6:45 from section, they're looking for a variance from section 213 of the board's rules and regulations for a subsurface sewage disposal system. So they're looking for variances. Is there anyone here? Kristen, why don't you give us a little rundown on this and then we'll see if anyone's even here.
Nope, we actually do have the applicant, so I'd love for them.
We're good.
If James Tetro is here, I'd love
Okay.
to present.
Good.
Sure.
All right,
To the board members, James Tatro from Azimuth Land Design, here with Jim Benincasa for Whitney Street Home Builders. We're asking you for is a waiver so that we don't have to create a superfluous parcel. There's a little bit of a disagreement in regard to the exact interpretation of the language of that particular section of your regulations, because it says for new construction, soil absorption systems shall be set back 25 feet from all property lines. And here's the tough part: with the exception of lots having a minimum lot area of 20,000 square feet or less, shall have a minimum setback of 10 feet to property lines. And it's that oddity of wording saying a minimum lot area of 20,000 square feet or less, which typically is a reference to a zoning district with that sort of a phrasing. What I had gotten out of that was that it was looking at saying that you would not have to have the additional separation to property lines if you're in a zoning district, which there are 7 of in Northborough that require a lot size of 20,000 square feet or less. Yeah, the other interpretation which Kristen was taking was that it's just saying that you have to have a 25-foot separation from property lines to your soil absorption system unless your lot is 20,000 square feet or smaller. And believe me, I have no animosity whatsoever towards Kristen. I think she's been put in a hard position by a piece of language that is at the very least imprecise. But the interpretation of saying that that you have that additional separation required unless your lot is 20,000 square feet or less, as in this case, can tell an applicant, well, if you just create a parcel and shave off your extra area above 20,000 square feet, that you can then go to a 10-foot property line setback. And I think we had submitted to Kristen just a draft version of a plan showing how we could cut off the back of both of these lots such that they both had exactly 20,000 square feet. They would satisfy the zoning in this zoning district, Residence C, and they would satisfy that interpretation of the regulation. But it would require us to create a sort of a superfluous parcel. And so we're not before the board asking for a waiver so that we can construct these lots. We're actually before you asking for a waiver so that we don't have to create a superfluous parcel. And I guess in the long term, I guess I would hope maybe that language would be cleaned up one way or the other. Again, in the lots that were recently built on Pleasant Street, dealing with two different predecessors of Kristen, we had talks with, I think, with both Casey and with Dennis in regard to this language. And on multiple lots, it was taken to mean that language is taken to mean as a requirement that you have a greater separation if you're in a zoning district requiring a minimum 20,000 square feet or less lots. I understand, again, I bear no animosity whatsoever toward Kristen. She's in a very tough position because the language is just horribly imprecise and I think actually sort of flawed. But I think if you take the interpretation that I think Kristen was suggesting, that just simply means 20,000 square feet or less lots don't have that requirement, then you're telling somebody in 7 different possible districts in town, if you're in one of these districts that requires 20,000 square feet or less, and you've got a bigger lot than that, shave off some of your lot, and then you can deal with a lesser setback requirement. And I mean, I guess I don't think I think it's unlikely that it was really drafted with that intention of incentivizing people to do that. But you know, that's what's on paper right now. And go ahead.
Yeah.
I'm sorry. This is Chairman French. It seems a little impractical for someone to come in on a half-acre lot and shave it down to 20,000 square foot so they can sneak the setback in. It doesn't make any sense. If I recall correctly, the reason that we added that in were because it's exactly what Kristen was saying. There were lots that were very small, older lots. They had cabins on them. The cabins are now occupied, and in order to tear down the cabin, put up the same exact footage, because the cabins are getting old, I believe this is what we were thinking of. The lots were very small, and was the only reasonable approach to maintaining that property.
But Mr. Chairman?
You're suggesting that you're going to cut off a piece of the lot to fit in under new construction under 20,000 square feet so you can get it in. I guess we'll have to look at that if that's what you're going to do.
Mr. Chairman, I think the issue maybe that's not being considered is that you have lots such as, especially one of these two lots in question, where you also have a limitation of, under your regulations, being 100 feet off a wetland. And that's actually a big part of the issue here, is that you have a lot where you have the lot line off Route 20, you have a side lot line, and you also have a restriction of the 100-foot buffer zone line. And you can have a perfectly reasonable sized lot. Both of these lots, in fact, are well over the minimum 20,000 square feet of a residency lot, but you have a restriction of what is allowable under your regulations because of the 100-foot buffer zone. It's not an unrealistic or crazy thing that the applicant is suggesting. It's just the circumstance or the context in this case.
If it's got to do with the wetlands and the buffer zone, then that would go to the Conservation Committee.
He's already filed and
Oftentimes,
got an amended order of conditions.
I think the setback issue with the 100-foot, I believe, is through the Board of Health, not through Conservation, right?
That's correct.
Yeah. So I don't think we wouldn't be able to, because we do have an order of conditions on the property. Sorry, James Benincasa. So we do.
Yeah.
We have an order of conditions on the property to construct the buildings and do everything that we're proposing on the lot, which was, obviously they issued an order. The issue obviously is just that, with 100 feet off of the wetlands to where the property line is, that's where, we're really getting squeezed, where the 15-foot difference is actually, does affect us really on one of the lots. The other lot, especially on one, not on the other. And I think, like James said, it was the fact that the regulation said, as far as the minimum, exactly what does the regulation say that, in a zone where it's with the exception of lots having a minimum lot area of 20,000. That's where we kind of, thought that maybe they meant to say in the zoning that requires a minimum of 20,000 square feet, just because there is obviously other zones that are what, 40,000 and up.
And again, we were going on the basis of our immediate past experience on lots on Pleasant Street.
Yeah,
where the interpretation that I've been suggesting is that it looks like it was intended to apply to lots in the zoning districts with a minimum lot area of 20,000 or less was accepted. Right. So we didn't go off on this on some sort of wild card tangent with no reasonable expectation that this was how it should be approached. It's how it had just been approached in other lots that were signed off on. And all we're suggesting to you here is if the board does not choose to issue a waiver, the applicant would just create an A&R plan to get both of these lots to just exactly 20,000 square feet, and then we would be in compliance. But it's not what we want to do.
The reason that I don't blame you. I don't think it's what you want to do.
Glenn, Mr. Chair, could I just make a quick comment about the police agents? It's been referenced several times. I didn't speak to Casey directly. I did run this by Dennis Costello, who's obviously worked with the Board of Health for well over 8 years. Just general his recollection is he's well aware of the 25-foot property line setback that the board has had in place for a long time. While he said, this is for new construction only, he couldn't remember issuing, a variance or a local upgrade approval or anything on that for new construction. That was according to Dennis. I can't speak what Casey may or may not have approved. But regarding splitting the lot, I did have a quick conversation with our assessor, with Julie, and just talk to her about what options would they have for breaking this off. And, I know you're trying to work within the set of the regulations, so I appreciate that. According to Julie, the town has something somewhere, and you could run it through the assessors or the zoning or the planner. If a small parcel is set off from another lot, the town actually has the ability to merge those, so we don't have a bunch of little pieces and chunks everywhere. With the exception is you could cut off a section, but it would need to be separate ownership to
Right.
really meet that criteria. And so I'm not the expert on zoning for sure, or, from the assessors, but, while I understand that could be a tool or a tactic to fit within the requirements of that minimum 20,000, 25,000. It wouldn't work unless you were to sell that parcel to another landowner.
I think you're correct, and I see your member, Mrs. Capabianco, nodding as
Yeah.
her experience on the planning board.
Right, yeah, so you end up with the merger of title situation, those two lots merged back together, you'd have to maintain them in separate ownership.
Right.
But then the other, I don't have a copy of the plan in front of me. If you shave off a portion of those lots, are you creating landlocked? Do they become landlocked? So there's no access to a public way for those shaved off parcels?
We could actually create this parcel with frontage along Route 20 because number one, number 144 has quite a bit of extra frontage.
So it would be sufficient to create a third parcel, even though it may not be buildable because it's wetlands. It would have sufficient frontage, though, so you could actually present it as an A&R plan.
Yes. I believe so, yes.
And like you said, it would be owned by an entity.
Yeah, so we want to just keep the two lots simple as they are, but this interpretation of the regulations ran counter to what we had just dealt with on Pleasant Street, and so now we're asking for that waiver so that we're not asking you to create a buildable lot or to make a lot buildable. What we're asking is to let us not have to create a parcel, which we really don't want to.
And we did
What
do this.
variances are we actually looking for?
And the reason
Rather than written down.
Only from the section 113 of your regulations, which says that for new construction, solar absorption systems shall be set back 25 feet from all property lines. Again, with that odd wording, with the exception of lots having a minimum lot area of 20,000 square feet or less, being allowed 10 feet.
in which the hardship would be wetlands.
So, Mr. Chair,
Yeah.
if you'd like me to share the screen, if that would be helpful, just to take a peek. I just want, these
I
are
think it would be
parcels side by side, and one is a 6 and one is an 8 bedroom. So these are large systems.
So we have 4 sides, all 4 sides, they're looking for a variance. Because there are 2 properties, so each property requires a variance, the 144 and the 150.
Yeah, we're asking for a variance on both because we don't have we don't propose the soil absorption systems to be 25 feet off of the front or sideline on either lot.
And how far are they on the street side, right?
I don't have it in front of me. Perhaps it was 12 feet on both cases.
All right.
It's, I'm looking, so lot B, I got to check on the numbers, it's looking like the closest point, you're 14 feet from the front of the property. It's fine on the side. It's not, it doesn't have a number for measurement off of the other property here. It looks like 16 feet from the corner of the SAS on lot A, 12 feet, right here, from the road. But again, I would think that number, and maybe I need to zoom in. I don't know if that's an 11 or where that, maybe it's a straight number. So again, they're.
Sorry, I don't mean to interrupt you, but all I can see is your bookmarks on the side and the word code in a single line. I think your screen is frozen again.
All right, let me,
Yes.
okay, sorry.
And Mr. Chairman, one other thing I just want to briefly mention is I know in one other town which increased their side and property line setback requirement, they said that they did so because A lot of times there's uncertainty about where the exact property line is, and for that reason, they wanted to require a greater separation. And I just wanted to point out that if you look on the plan like you see now on the screen, you see iron rods set in multiple places. This has been recently surveyed, and as those phrases imply, monumentation put in. So there's not, in this particular case, if any part of that desire for the greater separation is because of uncertainty about property lines, there's not any uncertainty in this case.
Thank you. In the past, I'm going to start breaking it down one by one. In the past, not necessarily for new construction, I'm sorry, not necessarily for new construction, we haven't really balked at a request for a variance from the road end of it. So if we go for the road to the property or to the septic, I'm speaking for myself, I've never had a problem with allowing that variance. Okay, so that's for myself, and I don't know how the board's going to feel about it. So if we take those two variances out from the road to the septic, okay, then we have variances between the two proposed properties. Excuse me. So those variances are, I don't know, I can't read how close you're supposed to be. And I think you might have already answered the 12 feet and 14 feet. Is that what you said? And then the going on each side of the proposed septic, is it encroaching within the 25 feet on somebody else's property besides these two buildings?
I think the regulation is regulation 20 or 20.
Well, I can see it's 16, that lot A, 16 feet from the Pierce property to the
Okay.
south. Yeah.
And then on the other end,
I can't tell. Might be close to qualifying there. Can't read that.
yeah.
I'm sorry.
Okay, so it's 16 feet from the Pierce property. What does Pierce have to say? Anything? Have we heard from Pierce? Has Pierce been notified?
It has not. We have good relations with that party, but he has not been notified.
Yeah, Mr. Chair, it is 11 feet on lot B. I pulled
Okay.
up the full-size plan here. So it would be
Okay.
11 feet. Nothing with the other abutter. I don't know if you're seeing me move the screen. I hope so.
Yeah, yeah.
Here's 16, and then, 11 feet from the new lot, or the new house.
And then on the other side, we have no problem? On the furthest side, across from,
Right, yeah.
Lot
It's
B,
a
yep.
long lot there. So not talking about
Okay.
the road, but just the
all
side.
right,
Okay.
okay.
So is
So
there a
the road-
chance for the engineer sorry, Mr. Chair, to shift this system to meet the 25?
Unfortunately, that thick black line you see just beyond, let's call it the northwest corner of the soil absorption system, is the 100-foot buffer zone line, which your regulations say you cannot put the soil absorption system within that.
Okay.
The wetlands buffer zone.
Yep, yep.
And what about this property, the lot A, I believe? Could that be
Um,
shifted?
It's a little closer. I'm not sure exactly. I have to admit. I mean, I look at that dimension off of what would be the front right corner of the house of 31 feet to that property line. It looks like that's pretty close to the same dimension from the soil absorption system to that property line. So maybe there's 5 feet or so extra. So the question would be, can everything be shuffled enough to get
An
out of
additional
it on that
5.
lot? It might be possible. I'm just not sure.
As far as the wetlands go and variances in the past, again, dealing with repairs, not new construction. we've often said as a board that we would allow it contingent upon the approval of the Conservation Commission. And that's what I was trying to say earlier. And I know you've gone through and got a list of conditions, and that's fine, but we have actually said, listen, this is, conservation. If you want to encroach on the wetlands, go to the Conservation Commission. And if they say it's okay, then it's okay. So that's something that I was bringing up earlier. It might have been misunderstood.
I think we misunderstood.
Yeah, we misunderstood you on that one.
Yeah,
Sorry about that.
that's okay. So it seems to me the big problem that we have here is we can grab another 5 feet between the properties for the septic system. The road, personally, my position is I don't have a problem with going closer to the road with the systems. The big problem that we have here is the wetlands. So let's talk about the wetlands. How far into the wetlands? It's a 100-foot buffer. And what do we get? 85 feet? Is that what you just said?
Yeah, I mean, to the chair, we had a pretty good discussion in the process with the Conservation Commission. We went to 2 meetings.
Yeah.
And their primary objection, if I could put words in their mouths.
Yeah.
I hope no one has a problem, but they wanted us to make sure to adhere to their requirements of structures 35 feet away and work 25 feet away. And they wanted us, we had earlier proposed steeper slopes, and they wanted us to have no slopes steeper than 2 to 1 leading down to the wetland. My first reaction is I guess I don't see that they would have a problem with the soil absorption system being whatever, pick the number, 85 feet away instead of
Right.
102, but we didn't test that.
So, Mr. Chairman,
So
when you,
sorry.
sorry.
I'm sorry, this could actually work, even though it's new construction and we're entering uncharted waters. Honestly, if it's 85 feet as opposed to 100, and the Conservation Commission has allowed that on repairs, you set up the bales and you take care of business that way. We could move that septic 5 feet over. So now you're at, it was 12 plus 17 feet as opposed to 25, which is, not an awful thing. And then we have the variance going to the road. Those are the 3
Right.
problems that we have with this thing. So is that it? Am I correct? In my assumptions of what we're looking at?
I think you're correct in your representations, yes.
All right. Kristen, am I missing something, or is that pretty much bringing it to the forefront?
No, I think you've covered it, so we're
Oh,
just
there's a
talking
mirror.
about
We
shifting
should end
focus.
the meeting right now.
Yeah, provided, so I guess I think what you're summarizing your proposal here is that, Mr. Chair, that they would revise the plan to meet the 25-foot setback from abutting properties by relocating or slightly shifting, I don't have east, west, north arrow, my arrow here, but the board, you're saying, would be okay with a reduction in the 25-foot setback from the road. So we're not looking.
I would be, and I can't speak for the other board members, but maybe somebody wants to chime in at this point. I'd entertain any further comments from Dr. Jane.
Yes, I don't have a problem with the setback to the road. I think we've done that in the past before. And it's case by case basis, right? We try to maximize
Right.
the utility. So it has to be a case by case. So with that being said, I mean, there's not many places where you can put the septic system because you can't put it behind the house. You're sitting on the wetlands at that point in time. I think if it can be moved 5 feet, then at least your immediate neighbor, you will have about 20 feet between them, and that still doesn't meet their 25, but that's at least much more tolerable. If you're 85 feet from the wetlands, and as long as conservation doesn't have an issue with it, I don't have a problem with that either. So, on all 3 accounts, I think I'm good from that standpoint, provided we move it 5 feet.
Right. Dr. Sane. Any comments or concerns?
No, you and Dr. Jain have, explained it so well, frankly. I agree.
Nailed it.
Yeah, you nailed it.
Okay, Attorney Capabianco, this I want to hear
Well, I agree
from the
with
planning
trying-
board experience that we've had.
I agree with moving that system over as much as possible to create the setbacks or come as close to conformity with the setbacks as possible. And, I don't have enough experience on this board to say that the front yard to the street setbacks is a good or bad idea. So I would defer to the members on that one. I really have a big problem with creating an empty lot with frontage that really can't be used
Right,
for the purpose of trying to meet a bylaw. I think just there's a whole host of reasons why that shouldn't be done. So if there's a way that you can create this system to be less non-conforming, I guess is the way to say it, then I would appreciate that being done rather than creating new lots.
could those lots even really be created? Isn't there zoning that says you can't break off certain? You can't create in this, I don't know what the zoning is on this particular spot, but there is zoning prohibiting breaking off pieces of land that don't create a buildable lot, is there not?
Right, and they
I
wouldn't
think
be able to
there
get, they wouldn't be able to get an A&R plan approved if that third lot was not otherwise a buildable lot. So
Right,
which is why I asked if this is going to be landlocked or if there's going to be frontage associated with it. So apparently there's enough frontage to give the back lot access from the street. It just wouldn't be a buildable lot. And so,
Right.
For all intents and purposes, if global warming continues and the wetlands all dry up, you may end up with a buildable lot in 50 years.
right,
But for today's purposes, it's not buildable from a conservation perspective, but it is from a dimension perspective. And that's why they could do it.
okay.
I think that's all correct. So Mr. Chairman, I think as we understand it, what we should do is draw up an alternative, trying to achieve better compliance, such as you and Mr. Jain have suggested. And I think our first action after that would be to speak to the Conservation Commission's agent, Ian McDonald, and ask what we would have to do. Is that if we stayed such that we did not change our limits of work on the property, which I think it would be the case, to see what we would need to do, if anything, would we need to file to amend the previous order, or would such a change, essentially a change of grading in a front yard, be considered de minimis? And we would find out how we would have to handle it with them, and we would also circle back with Kristen and see where everything stands.
Yeah, I mean, board's willing to work with you. We're not trying to prohibit building.
We
And
appreciate that.
It's close.
Okay.
And I appreciate you taking the time to look back into it and see if we can't get it closer. But the board's position at this point, and this is new, again, this is for new building. We never wanted to start, heading down this road, so to speak, and because you know how tight land is getting, and it's always been this way. So we've always been hesitant about variances for new construction, but in this case, we're close, and I would be willing to look at it again.
Should we ask that you continue this hearing to your next meeting?
I would.
Okay. Mr. Chairman,
That was a good yes.
I would request that the board please continue this hearing to its next meeting.
All right.
So, and just
I
one
don't think we
question
have to vote
also,
on that.
yeah, James, is there a consideration for, I know you have infiltrator 4s, I think, here, you're doing infiltrators. Is there another technology that would have less of a footprint that you could also look into that might solve all your problems aside from conservation? You might be able to.
That's a good point, Kristen. Excellent point. Yeah.
Yeah, maybe a backup plan.
Yeah.
And the only other thing I'd look to consider is we give the variance, if there's a variance granted from the 25 feet off the road. If you guys know this lot, it absolutely drops off from the road. So I'd like to know that we have curbing or something there, that we're not going to have water going into the system, so I'm sure you're going to
Oh,
take care of
yeah,
that
yeah.
from grading. But I'll when I drive home, I'm going to take a look at the curbing because it is so close to the road and it drops right off. As we get this system closer, I'd just be worried about that groundwater.
No,
Or not
it's-
groundwater, sorry.
That's a good point. And what you'll see is at that section of West Main Street / Route 20, there's a standard old Mass DOT Type 3 curb there.
Okay.
So really the only runoff that can go over the system is what falls on the outside of the existing sidewalk, and
Yeah.
there's very little bit of frontage, very little bit of front yard uphill a bit.
Yeah. Could be quite the flash flood down there.
It was really good soils, actually.
Yeah, well, that's good. It's a unique piece of land
Okay.
for that area, because everything else in that area, it seems to go up from the road.
Right,
And
we
you've got
picked the
this
lowest
one-
point.
You know it. What's going on. All right, so I suggest that we wrap this up for everybody's sake. We'll continue it to the next meeting, which we'll set in a minute, which will be, maybe we should do that now. Could we find a meeting for July 2nd Tuesday? Katie,
13th, July 13th.
Yep, July 13th.
July 13th. And everyone, I'm available.
I'm available.
Dr. Sane,
Yeah, I think I'm in town.
okay. And Attorney Capabianco.
Yes, I know the groundwater's meeting at 7, so I'll be available for 6. for sure.
Okay. Very good. Okay, so we'll set the meeting now for July 13th, 6 PM.
Sounds
Thank
good.
you for your time and your
Thank you, Warren.
consideration.
Thank you.
Okay, where's Jim?
We had 3 Jameses on the call. That's pretty unusual.
Is there any other business, Kristen, that we should discuss?
No.
Okay.
Good,
Good.
good. All right, then, the chair will entertain a motion to
Adjourn.
Sure.
adjourn. Thank you.
So moved.
I second it.
All those in favor?
Aye.
Aye. Aye. Okay, then we'll take this up